What do you want to talk about?
Well, thanks for coming, first of all.
Happy to be here.
Let's talk travel.
Yeah.
Where have you just
I've been doing a lot of it lately.
Yeah, I bet.
I started in Portland, Oregon.
Okay, so we're talking
Northwest.
West Coast, yeah.
Northwest,
yeah.
and then went down to LA, then over to Sydney. And it was like, I mean, that alone was like 20 hours.
Yeah.
And I was like, you feel like I must almost be there.
Yeah.
But then
no.
I have to fly 5 more hours
That's
to
right.
Darwin. This is a large country.
This is a large. Well, America's a large country too.
Well,
right?
I think I think they're roughly, when you discount Alaska,
Yes.
I feel like the continental U.S. is about the same size as Australia. So it's very comparable.
I think, because flying east to west across the
Except
US
you
is
get to be your own continent.
That's true. That's pretty cool.
That's pretty cool.
It's pretty cool.
I don't know what kind of benefits that gives
Yeah.
you, but
we just
probably not much.
Exactly. We just tick more boxes on bingo. That's all.
Yeah, bragging rights.
Yeah.
There you go.
So when did you arrive in Darwin?
I got here yesterday around noon.
Wow.
Yeah.
Okay.
And then got to take a shower and basically come to the reception.
And get mobbed from what I could
I
see.
did. It was great. I took a lot of photos, met a lot of people. I don't remember any of their names, but that's okay. Everybody's very nice.
Everyone's so excited
And
to
almost
see you.
as soon as I got here, I was handed an alligator.
Yeah,
a crocodile.
cool. Yeah,
it was a crocodile.
It's a croc. Yeah,
Yeah, it was cool.
Yeah,
It was
cool. And that's what you need to take home
That's
with you.
exactly what I would expect from a medical conference in Darwin.
Excellent. So first time in Darwin?
Yeah, definitely.
So you've only had an afternoon here. What are your first impressions?
Yes, not much. It's about what I thought. I knew it was going to be kind of like people described it to me as the Florida of Australia.
Yeah, right.
Which that might not make sense to some people. Excuse me. But Florida is very muggy, very humid,
tropical,
very hot, tropical.
Yeah,
and so I knew this would kind of be like that.
Yeah,
and it is. And but I don't mind the heat. You know.
Cool.
Yeah.
And are you going to have time for some sightseeing afterwards?
I might do a little bit. People keep telling me about places you can see a bunch of crocodiles. That'd be cool. Actually, I haven't seen a whole lot of that kind of thing.
Yeah, cool. There used to be a place right in town. I don't know if it's still open, but you don't have to go far at all.
Right. I'm going to take a look at that. And also, there's a place where some person in their whips. It's like Tim's whips or something.
Cool,
I don't know. It's like a whip collection.
So you're going to go get whipped. Fantastic.
I don't know. People are telling me all kinds of things to do at the reception. So I only have a few days, but I'm going to try to make the most of it.
Awesome. And any plans to travel back to Australia in the near future?
Next year, actually.
Cool.
I'm going to probably bring the family next time.
Nice.
So we were here last year.
Yeah.
I did an infectious disease conference.
Yeah, I saw that. In Adelaide, wasn't it?
Adelaide, at the Adelaide Oval. It was awesome.
Oh, wow.
And then, so I was like, I want to come back as often as possible.
Yeah,
I love the people. I love
cool.
Australia. The
we
culture
love having
is
you
great.
Here. Yeah, cool.
And then this time, and then next year, it'll be the surgeons.
Oh, good.
Yes.
So that's typical anaesthetists. We always get in first, right?
Yeah, exactly. That's a good point. Yeah.
Can I ask you about Dr. G?
Yes, please.
Dr. Glauckomflecken.
Yeah, that's the whole reason I'm here.
Yeah, awesome. I'm going to ask you perhaps a challenging question or a controversial question right off the bat. Have you got a favourite?
Favorite character?
Parents and their children. It's like you're not allowed to have a favourite kid, but come on, you must have a favourite.
My favorites, they change from like, for a while I was doing all these like therapy videos, and so I really loved to play the psychiatrist.
Yeah.
It's like the worst psychiatrist on earth.
Yeah.
Lately, orthos, I've really enjoyed ortho.
Really?
Yeah, ortho's fun.
Okay.
But also like the some of my most popular videos are the ones that take place in an operating room.
Yeah.
The communication and relationship between the anesthesiologists. Should I say anaesthetists while I'm here?
We can work with anesthesiologists, but we say anaesthetist.
Well, it's easier to say anaesthetist.
Yeah, there's less letters.
It's fewer syllables.
Yeah.
But anyway, I like the relationship between the anesthetists and the surgeons.
Yeah. We love that relationship too.
Love hate, right? I mean, sometimes it's mostly good, but
yeah. No, I love your content. Love the way you just capture our specialty. It's
well,
so
that's always kind of an interesting thing to me is when I go to different countries, like how much do you relate to the content? And from everything I hear,
100%,
the specialties
translatable
are they translate to any country.
Yeah.
It's like all the the surgeons and the neurologist, whoever it is the same in different parts of the world. So as far as
stereotypes are global.
Yeah,
exactly. Cool. How did Dr. G come about?
Oh man, I was it was in part kind of a coping mechanism for me.
Yeah, right.
With my cancer diagnoses I had, and I'll be talking about this at the keynote at this conference. But it's I had testicular cancer, and in med school I was diagnosed with that, and I had done a little stand-up comedy.
Yeah.
And once I got too busy with medicine to do stand-up, I started turning to social media and using that as my creative outlet to not only process some of the things that I was going through in life, but also I just love telling jokes.
Yeah.
And this was a great way to do it. And there weren't a lot of people doing medical comedy. And so it's like,
true.
you know what? This seems like a large group of people that could use someone making fun of them on a regular
That's
basis.
True. That's true.
To laugh at yourself a little bit. Sometimes we take ourselves very seriously for good reason, but sometimes a little bit too seriously. So it's like, let's bring some humor into this a little bit. And so I started Glauckomflecken, which the word glaucom, that's actually an ophthalmology term.
I was wondering where it came from. Yeah.
So it's hilarious. It's a term used for. It's an exam finding in patients with angle closure glaucoma.
Okay, I wondered if it had something to do with glaucoma. There you go.
It does. And so I was like, but really the reason I chose it was just because I was trying to come up with like the silliest word I can think of in ophthalmology. And so it was Glauckomflecken. It was either that or Dr. Pseudophacodenesis. But that was a little bit much.
That one
a little bit too
I would
much.
have a lot more trouble
it'd be a little harder.
Yeah,
so I went with Glaucomflecken. I'm stuck with it now though. So that's
it's a perfect thing. Perfect.
I think it works well.
Yeah. How do you? Well, your audience, I think. From my point of view, is mainly doctors. We just love your content.
Yeah, it's a lot of doctors.
Do your patients know about Dr. G? And what do
Some
they
of
think?
them do.
Yeah.
Most of my patients in ophthalmology are older, so not exactly the TikTok generation.
Yep.
But more and more, especially over the last couple of years, I've had more people come in and be like, "Oh, my daughter found out." This is like an 80-year-old patient I'm seeing. It's like my daughter found out, who I was seeing for my eye care and sent me a video of yours. So they hear about it a lot from their family members who are on TikTok and social media a little bit more. And so it's not unusual to have people like bring it up to me.
Cool.
Usually like once a day at least.
Wow. Okay.
And it's always fun. There's always this concern with healthcare professionals of, saying things on social media or having a social media presence and being nervous that it's going to make them look unprofessional. And certainly there are things you can do that are unprofessional.
Yeah, that's true.
But I think we're a little bit too scared about that. Because
I agree.
In the end, I think patients really enjoy seeing that side of us.
Yeah. And who doesn't love a bit of humor, right?
Right? Yeah. It's all fun.
Yeah.
Now, granted, it's a little bit of a bias because, like, if people didn't like what they saw from me on social media, they probably wouldn't come in for an appointment.
That's true.
Yeah. So I'm only seeing the people that like the stuff.
That's all right.
But that's okay.
It's okay to have patients that come to you because they like you.
Exactly. Right. That's a good thing.
That's not a bad way to screen your patients. What in terms of balancing your clinical work and your because content production takes a bit of time.
This was the most common question I got last night at the reception here was, are you still practicing clinically?
Yeah.
People are always surprised to hear that I am. In fact, 4 days a week.
Whoa.
Yeah. So, which is full time for ophthalmology.
Yeah. No, full time.
Yes, exactly.
4 days a week.
Technically, full time. But yeah, so 4 days a week, I'm either in clinic or I'm in surgery.
Yeah.
And then I have that 1 day a week. For me, it's Mondays where I'm either recording podcast episodes or making content or doing other things. And then nights and weekends is when I fill in the rest of it.
My goodness, you're having, dabbled. Your production process must be slick if you're punching out all that content in 1 day a week.
Yeah, I can't do it all myself. So especially when we added the podcast, now it's been like a year and a half we've been doing the podcast.
Yeah, cool.
It's we have a team that helps with all that. There's no way I could do that.
Yeah.
Like all the work, how much work goes into a podcast, the editing and the promoting on social media. And so that all we have a wonderful team that helps with that. And
awesome.
Kristen, my wife, now she's like the CEO of Glauckomflecken.
But Mrs. G isn't an obstetrician and a
she's not, but she's in marketing and she understands this world pretty well. And so she's on the back end.
She's convincing on your videos. I seriously thought she was medical.
That's the writing and the acting. She's really good.
Wow, yeah, she's great.
Yeah,
great
so
talent.
she does a lot of the business side of things and helps keep this thing going and growing strong.
Oh, good on you. What a team you are. That's fantastic.
I'm very fortunate.
Nice. Is she here with you on this trip?
She did not come on this one. We do a lot of traveling, and so we have to pick and choose.
Of course.
With the kids especially.
Yeah.
So sometimes I bring everybody with us. This was just a little bit too long of a trip, I think, for our little kids.
How old are the kids?
They're 9 and 12.
Yeah, it's rough jet lag in that age
group,
and
and they're in school now, and so it's much easier in the summer, obviously. But they just started school, so it's like I don't know if I should take them out of school for like a week, even though Darwin's a wonderful place, and my kids would have flipped out about the crocodile and the snake that were around here. Oh, they would have loved that.
Oh,
but,
for sure.
So next time.
My goodness. All right. Well, that's good. So we might see them in Sydney next year.
Yeah. Definitely.
Yeah. There might be a few anaesthetists now dropping into the surgical meeting next year. Can I ask you something a bit more serious?
Sure.
Maybe.
Of course.
You can make it funny if you want. Managed care.
Managed care, yes. What does that mean to Australia?
Well, they're making approaches in my mind. They're sort of starting that process, vertical control, buying hospitals.
Yep.
Starting
insurance, kind of private insurance companies.
Private insurance companies buying up hospitals, buying 49% shares of a hospital, so they don't actually own the hospital.
Well, maybe that's coming, though.
Yeah.
Because they certainly are in the U.S.
Yeah, because you've had your own experience as a patient.
Yes.
Through this. Tell us what that was like.
Yeah, it's whenever I had my cardiac arrest
Sorry
back
to hear
in
about that.
2020. I'm doing okay now.
Yeah.
I got my defibrillator. I'm good.
Good.
Just in
There's
case
a few people
again.
here around who know how to
Yes,
use
I've never felt more safe than at this conference. This is my first anesthesiology conference I've actually spoken at.
Yeah, right.
And I feel very safe here.
Yeah.
Also, if I need caffeine, it's very close.
We are here. Exactly.
Everywhere.
There,
it's literally the coffee is 10 feet away from me right now.
This is we know how to organize a conference.
So it's whenever I went through that, that was the first time I really had a lot of difficulty with the healthcare system on the patient side of things.
Yeah.
I've struggled on the physician side of things because, having to do
like pre-approvals,
prior authorizations, pre-approvals, and dealing with denials from insurance or they not wanting to pay for things that I think patients should need and having to go through that process.
Oh, sounds painful.
That's painful. But then once I was on the patient side and all of a sudden I had what are called surprise bills that now there's legislation in the U.S. to help protect against that. But basically, when I had my cardiac arrest, I was taken by ambulance to a hospital that was in my insurance network.
Okay, so that's good.
That's good.
First step,
But then some of the doctors in the hospital were out of network.
Okay, and that's where the complexity starts.
Yes,
and the bills start ka-ching,
Doesn't
ka-ching.
make sense, right?
Yeah,
but I started getting all these bills that insurance was barely covering any part of it.
Yeah.
And it added up to tens of thousands of dollars.
Yeah, right.
And I was, fortunately, I'm in the healthcare system enough. I kind of knew what was going on.
Yeah.
So I was able to fight them. It was still like 9 months of angry emails, phone calls. It was a mess.
And you're on the inside, intelligent, capable.
How are patients supposed to do it?
Yeah.
They don't. They either just pay it and use up all their savings,
go into poverty,
exactly.
Yeah.
So it's horrible. It just gave me that insight into what our patients are dealing with on a day-to-day basis. But it also changed my comedy. I started making videos about the U.S. healthcare system.
Yeah.
And then as I started doing that, people would email me and tell me about all these other terrible things that are happening in the U.S. healthcare system.
Yeah.
So managed care type things.
Yes.
Hospital consolidation under these mega corporations that are taking power away from the people that actually do the work of healthcare.
Yes.
And that is shaping the healthcare system in a way that's not so good in the U.S.
Yeah.
And so it's a shame to hear that some of that is starting to happen.
It's starting to happen here, and the insurers are saying, but this is not managed care. We're not going to end up with a US-style system. Stop scaring people.
Yeah, it is a bit of a slippery slope. You know, you start giving up some power to them, and it's they have so much money and so much influence.
Yes.
That it can easily get away from you.
That's exactly
and it certainly
what
has
I fear.
for us, because United Healthcare, which is the Optum, that's the largest insurer in the U.S., is now the single largest employer of physicians in the U.S.
Wow.
Right. And now you also have private equity companies
I've heard about
that are
them
dumping billions of dollars into the U.S. healthcare system, buying up practices.
Yes.
And
dumping them too. I think I heard about that. Like they buy up big anesthetic groups.
Exactly.
And then dump them.
It's a huge thing in anesthesia. It's a big. They're just, the purpose of them doing that is to make money, right?
Yeah.
And so it's this conflict between these private companies who have their goal is to make money off of this endeavor.
Yeah.
To buy up hospitals and physicians to make money off of them.
Exactly.
Versus obviously the physicians and healthcare professionals. That's not the primary. That's not why you got into it.
No, exactly.
Right?
Our goal is to get our patients through their episode of healthcare.
And so you're fighting these two motivations, and the income-driven part is winning in the U.S.
Yeah. Wow.
So
if you could do something to prevent that.
Yeah. Well, it's really got to start with legislation.
Yeah.
And it's starting to happen. There's been more efforts to curb the corporate practice of medicine. That's kind of the catch-all term for this type of thing.
Yeah. Okay.
And so, passing legislation that puts more regulation on the corporate practice of medicine, either preventing big mergers or trying to prevent, in some states, prevent corporations from owning healthcare practices.
Yeah, yeah.
Allowing more of that ownership to be put on, to be taken up by physicians.
Yes.
And which we know is outcomes are better.
Yeah.
Almost across the board with when physicians own more of the healthcare system.
Yeah.
And I think it just comes down to those motivations.
Yeah. I like that.
Why are we doing this?
Yeah.
Yeah, it's great to make money. We all like making money, and physicians do very well.
Yes.
But when it comes down to how to run a healthcare system, we have a motivation to help patients that corporate entities do not have.
Correct.
They have not done that work. They don't know what it's like to take care of a patient, to watch a patient get sick, to watch a patient die, to watch a patient struggle getting the medications they need because their insurance company won't pay for them. They don't have that.
They don't see that
insight.
Yeah.
And so that's why we need more ownership in healthcare of people that actually do the work of healthcare.
Yeah, yeah. Oh, good points.
Yeah.
There you go. Not just a pretty face. Some serious thoughts on it.
But the thing is, I really like what I've learned about the Australian healthcare system.
Yeah.
Because you have, in the U.S. there's one system, one way of doing it that people are advocating for is like what we call Medicare for all.
Yeah.
Which is basically just a robust public
health
option,
insurance company.
Right?
Yeah, yeah.
Not necessarily getting rid of the private option. And there's a lot of nuances lost in that description, but it's similar in some ways to what you're working with in Australia, where you do have a much more robust public option compared to what we have in the U.S.
True.
And that kind of thing has worked very well for the most part.
Yeah.
I think for Australia, one of the challenges, though, is just having the funding for it.
Correct.
Right?
Yeah. Like so many countries. Healthcare expenditure is just ballooning.
It's great for me to say, and other people in the U.S. to say, let's do Medicare for all. But
it costs.
They're not going to pay for it.
Yeah. Yeah.
You have to, if you're going to have that, you got to have the funding to actually support that program.
Yeah.
And so, I hope for your sake and Australia's sake that you don't go too far down the path of corporate ownership of healthcare, because it's not great for patients.
Yeah. Thank you for your comments on that. I just want to wrap up, but before I do, is there anything that you would like to say to listeners, our Australian audience, anaesthetists in general?
Just thank you for being so welcoming of Glaucomflecken. It was the coolest thing to find out that that people from around the country like the videos. Is not just because I just made them for myself and the people I work with, but then to hear about all
this
the
whole
love
country loves your work
from this part of the world that I've never been to. It's so much fun, and
cool.
and that's part of the reason I wanted to come back as soon as possible, because I was here in Adelaide. Is just because the people are amazing, and you guys are just fantastic, and
we're so happy that you're here. Thank you so much for coming. 25, 6, 30 hours, however long
it was a bit of a trip, smooth but long, but that's okay.
Well, thank you so much for making the effort. We really, really do appreciate
thanks for
it,
having
and
me.
thanks for joining me this morning.
Of course.
Cool. And I think there's people who want to hang out with you and mob you.